You may be asking, why Body Shapes Medical? I'm telling you, their staff, medically supervised. Very important to you as a patient, and very important to Body Shapes Medical. Lisa Innenbach, we're going to talk a little bit about hormones, and I'm going to let you introduce our next expert here. I have a team of them, so I'm going to be quiet and let you go to work.
Sure. This is Brandon Bledsoe. He's our nurse practitioner at Body Shapes Medical, and we also do hormone replacement as well. It's really, really important, like I said, to get the weight off, to keep the weight off. Sometimes it could be a hormone deficiency that is causing you not to keep the weight off. So there are different types of hormone that Brandon's going to go through here in a minute and talk about. We do all the major hormones. We look at everything. We look at the big picture. We don't just say, oh, here's some testosterone for the men, because all the men are talking about testosterone, and that's great. That is one of the hormones that will definitely help you, but we do medically everything. We look at all the lab work. We look at all the signs and symptoms. We treat the patient, okay? We do take blood work, and we do want to find out what your baseline is, but if you're telling us that you're having a certain sign and symptom, we want to optimize that hormone to make sure, because your level might be a little bit different where you feel comfortable at than someone else's level.
Interesting.
You know, sexual dysfunction, there's a lot of men out there with that. You don't have a Viagra deficiency.
Why do you look at me when you say that? You're looking right at me. She's just like, okay.
Because you're a man and you're sitting there. I'll look at Brandon.
And I'm older. That's okay. No, that's okay.
But I mean, you know, you don't have a Viagra deficiency. Your body is not deficient in Viagra or Cialis. If you're depressed, you are not lacking Prozac. That's not what's in your system. What we replace is bioidentically hormones that your body once produced. Does that make sense? It
makes perfect sense. You articulated that well, and I think a point to make, and I promised I'd shut up, but I think it's important to know. A lot of people think, oh, you're giving them steroids, testosterone. You want normal levels. We're not looking for bodybuilding levels, or you know, you're not looking for that. You're looking for normal levels, maybe the levels you had in your 20s and 30s instead of when you're 50 or 60, correct?
Because your doctor's going to look at you and say, well, you're normal for a 50-year-old, 60-year-old man, whatever your age might be. Okay, but I don't want to feel like I'm 50 or 60. I want to feel like I'm 25 or I'm 30 again. Why can't you get me to those levels? It is not unhealthy to have a higher level and for you to feel better. I mean, you can feel better. You can look better. So Brandon's going to go through some of the hormones, and then we welcome your phone calls. If you think you have a deficiency or a sign and symptom of one of the hormones, then Brandon can answer your questions on which hormone he thinks that you might be deficient in.
Yep, 571-5263. All right, nurse practitioner Brandon Bledsoe. Tell us about some of the hormones that you're very familiar with and what they do for the body.
Well, for men particularly, as you guys kind of touched on a little bit, is testosterone. Testosterone is very key for men and women. Big one for that is fatigue, decreased motivation, depression, libido, sleep disturbance, lack of endurance, increase in abdominal fat and overall fat. Women, the big three: estrogen, progesterone, and testosterone. Women need testosterone just like men do. Again, with women, it's fatigue, weight gain. One thing is decreased self-esteem with testosterone deficiency in women. For women, estrogen can cause an increase in abdominal fat if they don't have enough of it. Depression, hair loss, different things like that. All of these hormones need to be optimal, need to be at youthful levels. Helps prevent things like cardiovascular disease, Alzheimer's disease, bone osteoporosis. So all these hormones really help with all of those things in the body. And women with progesterone. Progesterone's huge for women. Women start dropping progesterone years before they do their estrogen, and so a lot of women have what's called an estrogen dominance. And in that estrogen dominance, they have depression, anxiety, headaches. Headaches are really big in women, particularly as they get older. Their premenstrual symptoms will get worse. Fibrocystic breasts, the nodules and things like that, that's all signs of estrogen dominance, fluid retention. So our goal is to really get your hormones balanced, look at a holistic approach to hormones, and really get you feeling better, but also improving your longevity of life.
All right, Brandon Bledsoe, thank you very much. Lisa Innenbach, and if you have any of those symptoms, you can call us, answer questions. 571-5263. We'll be right back with Body Shapes Medical.